The MPCCC is a network of Victoria's largest public and private cancer health services, with Monash University's world-leading research and education united by a shared vision to advance cancer care through research.
Well, it emerged more than a decade ago, really out of need. It was clear that patients in our region were not receiving the same sort of equitable access to cancer treatment as patients diagnosed in other parts of the state, and we knew that coordinated research efforts would improve that.
MPCCC was formed and comes together to enable us to take advantage of the great advances in cancer research, but also to make sure that those advances are translated as rapidly as possible into clinical contexts where patients are cared for by doctors and nurses. And having the MPCCC there as an entity that links a large number of hospitals and serves more than 10% of the entire Australian population, it enables us to do that rapidly and at scale to benefit as many patients as possible, as quickly as possible.
I can provide clinical excellence partnering with the MPCCC. Patients who haven't got standard of care where I need to actually test their tumour to see what their mutation is. I've got that up my sleeve. Have access to the research fellow, this person to collaboratively work with other MPCCC hospitals. That's really improving patient care. Then there's research. Without research, without clinical trials, we will still be palliative care doctors. We would not have done any advancements, and that's what the MPCCC is all about.
I think that's just so important to have clinicians and researchers come together to collaborate, to find the synergism, both in terms of offering state-of-the-art clinical care for our patient, access to clinical trials and research programs, but also that ongoing communication and dialogue, which I think is invaluable, not just in terms of education, both for clinicians and trainees, but really to actually advance the field of cancer.
Prior to joining the MPCCC, we didn't have those contacts with the Biomedicine Discovery Institute at Monash University, and now we have a very strong translational program, particularly in organoids and xenografts. That ability to connect with other investigators that you may never have known existed is one of the great reasons why we're in the MPCCC.
The MPCCC is a really collaborative environment. We have a critical mass of highly academic personnel who can share ideas, share expertise, share that translational scientific approach to then overall better patient care in the long run.
A network of oncologists in the MPCCC are listening to the patient experience today, caring for the community that is impacted by cancer, which means from cancer prevention, cancer diagnosis and cancer care, which means individuals with cancer and the community that need to support people with cancer.
We believe that every patient, regardless of their postcode, background or circumstance, deserves equitable access to the most up-to-date, evidence-based cancer care and resources. Together, we are determined to change the future of cancer in Victoria. To learn more about the Monash Partners Comprehensive Cancer Consortium and how you can support our efforts, visit our website or contact us today.